It's been nearly 10 weeks since Canada's V-Day, when the first COVID-19 vaccines arrived. That day has finally come for Africa. COVAX, the global initiative aimed at providing vaccine to countries in need, sent the first shipments to the continent. But as Crystal Goomansingh explains, it's the first step on a complicated path to make sure no country is left behind.
Precious cargo for the Ivory Coast. On board this flight, more than 500,000 doses of the AstraZeneca vaccine produced at the Serum Institute of India. UNICEF is responsible for moving the sponsored vaccine to countries in need around the globe. Benjamin Schreiber is the project lead.
We are super delighted to starting and rolling things out. We've been building this for the last year. Every day in the coming weeks, you will see new shipments leaving.
The very first COVAX-sponsored shipment in the world landed in Ghana Wednesday. The second in neighboring Côte d'Ivoire Friday, where the health minister was on hand to watch the historic unloading of vaccine. Speaking on the tarmac, he championed the democratic management of the pandemic. Rollout of the vaccine through COVAX has been slower than planned. 15 million doses had been promised to Africa this month, but until this week, none had been delivered. COVAX has relied on the cooperation of wealthier nations such as Canada and the United States. The U.S. initially refused to participate, but last week, President Joe Biden committed $4 billion to the efforts. Now, the World Health Organization is running a campaign with the hashtag Vaccine Equity and Support Healthcare Workers. It's asking more countries to sign a declaration with the aim of every country getting shots into the arms of healthcare workers and those most at risk within the first 100 days of the year. Dr. Kate O'Brien is a Canadian physician and the director for immunizations, vaccines, and biologicals for the WHO.
The loss of a healthcare worker in a low-income setting because of illness or, heaven forbid, for severe illness or death means that tens of thousands of people are going without any healthcare because of the loss of an individual healthcare worker.
We're going to have to work very hard now in the rollout and again look at it with an equity lens to make sure that no one is left behind.
COVAX is set to deliver 2 billion doses to more than 90 low and middle-income countries by the end of this year. Crystal Goomansingh, Global News, London.